A few years ago, my father, who was aged 76 at the time, became very ill very quickly. Up until then, he was in perfect health. He'd even gone to the races a week before his first admission to hospital. Things went from bad to worse. He deteriorated very quickly. The treatment wasn't working, and he started to get very frustrated, very demoralised very quickly. He stopped eating, he stopped drinking. He couldn't get his hearing aid sorted out, so he couldn't hear. People were asking me, how long has your father had dementia? Which he never had dementia. Then he became very angry, very withdrawn, and he started to say to myself, the nurses, I want to go now. I want to go now. Even when his nephews visited, he asked them to push him off the mezzanine floor in his wheelchair. We didn't know what to do. The last time I saw my dad, he said to me, you kiss me there, you'll never see me again. And I didn't, unfortunately, because the next day he died. So why am I telling you this story? Since this happened, I've spoken to so many people who've told me exactly the same story, where an older loved one of theirs has gone into a care home or been in hospital and started to give up. Now, I looked into this, thinking, what is this phenomena of giving up? I looked at national policies on suicide, self-harm, very little mention of older people. I looked at statistics. How many people, for example, have died in the last 5 years of suicide in care homes? It's just a handful, not more than 12 per year. Well, that's very strange because personally, I know of 12 per year, having just talked to family and friends. So what is this phenomena of giving up? Is it a form of self-harm and suicide? Why are older people feel that they have to do this? We did a study and we spoke to care home workers, managers, professionals, family carers to find out what they thought. Did they recognise this form of self-harm and suicide ideation and behaviour? So many people had experiences of it. They felt very disenfranchised, really didn't know what to do, were dealing with really difficult communication and end-of-life issues with very little training. We also did a systematic review. Again, hardly any tools or protocols and least interventions to deal with depression and self-harm and suicide in later life. So my question is this: if a younger person stopped eating, stopped drinking, repeatedly said they didn't want to live, what would we do in those circumstances? It's a form of ageism. We really need to give skilled professionals, we need to train staff to make sure that they are able to have proper conversations with people, to do risk assessments. We need proper suicide prevention and end-of-life care. And we need to do more research into this idea of giving up or turning to the wall. So, let's break the silence on this and let's not give up. Thank you.